we had at the board meeting on Tuesday, at our recessed meeting, we had a very sobering report from our county manager, specifically dealing with some of our first responders and some of the concerns facing those first responders. Can you give us a little insight on that?
Yeah, that was actually, I think I said it at the dais, that was the most sobering report I'd gotten. I think I've been doing this about a quarter century, schools and now here. And it's interesting because we just talked about going from crisis to chronic, and this actually was a chronic condition that has become a crisis. And that's what the manager was talking to us about. And the issue kind of that precipitated the crisis, if you will, is the state moving to, they closed a number of the mental health hospitals, and when people are in mental health crisis, they need to be in a hospital, and suddenly there's no hospital for them. And we have been understaffed with our mental health, the folks that work in mental health in crisis care. We've been down a number of staff, and all of a sudden we had the need went up, and we were still struggling just to meet the need before. And suddenly, when somebody's in crisis, they need to be in a hospital. So that Virginia Hospital Center, which is, at least there's a hospital for them, the police have to often stay with that person until they get actually admitted. So we have police for 12 hours staying with a patient at the hospital, and we are down on our police as well. And that gets into a lot of different situations. I'll, Matt, let you see it. The way I see it overall is right now our caring professions have been underpaid. Teachers, nurses, childcare, police, mental health professionals. They've been underpaid for a long time. That's just the way the society has been. And suddenly their real worth is coming to the fore. I mean, I often said we found out that our most vulnerable workers were also our critical, most essential workers, yeah. Mm-hmm. And we're in a real transition time, and this really came to the fore at our meeting. So I don't know about you, but my stomach clutched a little bit listening to that. So
sure, and I know we each felt it personally as a critical moment. And the manager, county manager, came and described the challenge and described that there are retention issues with our police department and our mental health counselors and supports. So what we did is ask him to, over the coming weeks and month, he's going to come back with a proposal that will be some significant resources on retention. So we're thinking this is more than $1 million at least, could be up to $3 million, to really help with retention for our police, our mental health providers. And it was made so clear by our lead staff, Chief Penn, Department of Human Services Director Anita Friedman, and we also heard from others. But this is one where the whole board said we have to move forward, we have to support the manager's effort to develop the right plan to address this retention challenge.
And I think also, which we tried to emphasize, we're still meeting the critical needs, and the police are still stepping up, but there's a lot of nice to-dos that in the long run make a huge difference that we're having to probably cut back on. And we will get through this. I'm assured that we will. But we're going to have to change a little bit how we're funding things and what we're doing. Mm-hmm.